The purpose of this video is to demonstrate the release of the ulnar nerve in the canal of Guyon. Frequently mistaken for carpal tunnel release, this incision is actually more ulnar or more towards the pinky side of the wrist on the palm aspect of the end of the forearm, or the distal end of the forearm. The reason for doing this release is to decompress the ulnar nerve, which actually sits outside of the carpal tunnel. This procedure is actually fairly unusual to perform because most compressions of the ulnar nerve are causing numbness in the fourth and fifth fingers and possibly weakness to the fine muscles of the hand, of which the ulnar nerve controls about 80%. The compression is usually found up in the elbow. In this patient's case, there was a localized compression of the ulnar nerve in the wrist. The incision is brought down to and through the skin. Great care is taken not to injure any superficial vessels and sensory nerves. This approach is also fraught with concern because the ulnar nerve can be injured in the course of this dissection, and adjacent to the ulnar nerve is the ulnar artery and small concomitant veins that travel along with the artery. There is a ligament which overlies the ulnar nerve. It is called the volar carpal ligament. The floor of the canal of Guyon, which is created by the overlying ligament, is superficial to the carpal tunnel, and the floor of the canal of Guyon is actually the transverse carpal ligament, which is actually the roof of the carpal tunnel. So we're really talking about two separate compartments. Now one can see, while dissecting the ulnar nerve, right below it is dark structures, and those are the concomitant veins that overlie the ulnar artery. The ulnar nerve is gently teased apart and freed and followed into the hand. The incision must be extended into the palm because the ulnar nerve must be dissected free all the way to its bifurcation. As the ulnar nerve exits the canal of Guyon, it divides up into two branches: the sensory branch, which can be seen on the top of the nerve, and the motor branch is below. One can actually see the Y-shaped aspect of the nerve. There is a small rubberized vessel loop that is placed around the nerve to protect the nerve and to allow gentle mobilization of the nerve so that one can free up the tissue underneath the nerve without risk of injury to the nerve itself. Now the nerve is being dissected away from the ulnar artery and completely freed up. One can also see vessel loops placed around the ulnar artery and allowing mobilization of that artery as well.